Hello everyone, my name is Steve. Today I'm gonna administrate the IV secondary tubing, the IV medication via the secondary tubing to my patients today. First of all, I will check the environment, please. To make sure you can see, I got all my supplies on the table. MAR, physician's order, my IV bags and the medication cards. Okay, now let's back. Okay, let me back it. I only use this one. Okay, first of all, my job is to get more information according the MAR and the physician's orders. Okay, first of all, I will verify the MAR and the physician's order. The patient's name is Fiona Schrank. Fiona Schrank, date of birth, February 25th, 1980. The MRN number 00974617, MRN number 00974617. The diagnosis is the laparotomy, small bowel resection, and sepsis, the same thing. And the medication's name, methylprednisolone. So the dosage is 250 milligrams. The route is IV. The frequency is BID 2 times a day. So 10 a.m., 10 p.m., 2 times a day. So the reason is the patient just after the laparotomy surgery, and she has the small bowel resections and has the sepsis. We have to use this medication to anti the inflammations and reduce the immune response. So that's my first, not first, this is just verified MAR with the physician's orders. Now I'm gonna do the first check. I perform the hand hygiene. Perform the hand hygiene and wear the glasses to do the first check. First check, I still use with the MAR and with the medication cards. The medication inside. The patient's name, Fiona Schrank, date of birth, February 25th, 1980, MI number 0097 4617. The allergies is the no known allergies. The medication's name is methylprednisolone. The dosage 250 milligram. The route is IV. The frequency is 2 times a day, and the reason is the anti-inflammations. So now in my first check, I will check the expiration date. You can see from here, expiration date here is 2027. The next year, 12/26 is not expired. No known allergies. So I finished my first check with the MAR with the card. Now I'm doing the calculation because the physician's order is 250 milligrams and the medication here is 500 milligrams in 5 milliliters. I should do the calculation first to get the correct dose. We use the formula D divided H multiplied Q is the doses. The order is 200 milligrams and we have 500 milligrams and in 5 milliliters. So 250 milligrams divided by 500 milligrams multiply 5 milliliters. It should be withdraw 2.5 milliliters per dose. That's my calculation. I did already. So I should withdraw 2.5 milliliters per dose. Okay, I got the right calculation. Now I'm going to do my second check. Second check is with the MAR with the medication, not the card. You can see this is my medication, and this is my MAR. Patient's name is Fiona Schrank. Yeah, date of birth February 25th, 1980. MRI number 0097 4617. So the medication's name, right patient's name. The medication's name methylprednisolone matched. Okay, the dose is 250. I always draw 250 from here. And the route is IV, just IV route. The frequency is 2 times a day, BID, 10 a.m. and 10 p.m. BID, yes. That's the right reason, right reasons for anti-inflammations and reduce the immune response. Okay, and on this check, I will double check with expiration date is 2027 next year. It's not expired, and no allergy again. So I finished my second check. Now I'm gonna withdraw the medication from the right doses, not 500. We need 250. So we're gonna perform the hand hygiene again. I'm gonna grab. Because I will withdraw 2.5 milliliters, so I will choose the syringe 3 milliliters. Here, you can see here is the 3 milliliter syringe. I will use this one. I will use the aseptic techniques to withdraw the medication from the vial. First of all, I will use the blunt needles. Open it, twist in, not touch anything here. So I got the right medications. Now I use the alcohol swabs to clean the top of the vial. I take the plastic, remove the tops. Use the alcohol swab to clean the top. Now, I use these blunt needles. First of all, I will put 2.5 milliliters air inside, maybe more a little bit, maybe take 2.6 milliliters air in the syringe first. Then I pick this one. After I clean it up, I just 90 degrees to push in. Okay, now I'm gonna push the air inside. You can see, push the air inside. Then you can see, I put the label faced my thumb. I can see the fluid here. I put the needles top a little bit lower than the solutions. So let him withdraw 2.5 milliliters. I will put a little bit more because I'm gonna prime it. Now I just check any bubbles inside. If bubbles inside, we put the needles inside the air, then tap. Yes, make all the air bubbles out. Now I get 2.5 liters more, a little bit more. Okay. Now we're gonna prime it. Prime it to the right, put the bubbles out. Yes, you can see in the air line. Now I got 2.5 milliliters medications. Now, I just recap it. Keep the aseptic techniques. Because I finished the second check, now I gonna take my mini bags, put the medication inside. This is 100 milliliters mini bags. I'm gonna use a new alcohol swab to clean the side, clean the pot. Clean the pot here and wait for drying. Now I'm gonna put 2.5 milliliters medication inside. Okay, 2.5 milliliters methylprednisolone inside already. Now all the medications in the mini bags already. What I should do next is just label it. On the label, we should mention the patient's name, Fiona Schenk, and the medication's name, methylprednisolone, and the dosage, 200 milligrams, and the route IV, and today's date, May 29, 2026, and the time at 10 o'clock, and my initials. I did everything already, so I just put the labels on. Now the medication already. Now I got everything. I'm gonna take all the supplies to my patient and do my third bedside check. I remove the gloves. Start. Okay, now I will be the resident's room outside the door. I will knock the door. Knock, knock. May I come in? Okay, yes. Okay, I come in. Come in. When I check in, first of all, I have to introduce myself. Hi, Fiona. How are you? I'm your student nurse from Shenton College. Today, I'm gonna give you the IV infusion. Is that okay with you today? Yes, she got residents' consent first. Then I will ask the residents do the two identification. Hi Fiona, can I get your full name and date of birth? Fiona Schrank, yeah, date of birth 1980s, February 25th. Okay, correct. Thank you very much. Now I'm going to my third check. Third check about right patient. I did already. Right medications. My MAR. Methylprednisolone. Yes, methylprednisolone in the mini bags already. So the dosage 200 milligrams inside already, 2.5 milliliters inside. And IV, we're gonna use the IV route and twice a day BID. And the reason is anti-inflammations. So I will continue to the education, right education and right of refuse to my patient. Hi Fiona, today we're gonna give you the methylprednisolone today by the IV. Methylprednisolone because you after surgeries, you just finished the laparotomy and small bowel resections and you have some sepsis. So this medication will help you anti-inflammations and will reduce the response of the immune, so make you feel better. Is that okay today with you? Okay, thank you. But you still have the right to refuse, say no, not today, it's okay. It's okay today? Okay, thank you. I got residents' concern. So now I'm gonna administer the IV set. But first of all, I have to check patient's IV site. Fiona, do you mind let me check your IV site? Okay, the IV site we have checked the three things. One is the infiltrations about the pain, swelling, polar, and the pain of swelling, pain of insertion site and edema. There is no inflammation here. The second one is the phlebitis. Phlebitis is the temperature of the site. Let me touch it. Temperature is fine. Pain and erythema along the veins. There is no erythema along the veins. The filler is fine. The phlebitis is fine. The last one is the infection. The infection is about the chill or getting any fever and tachycardia and hypotensions. So to the vital signs this morning, everything is okay. She don't have any infection site. Now I can sure the IV site is ready for the IV infusion. Now I'm gonna set my Alaris pumps. First of all, I prefer my hand hygiene. Get alcohol grams. Wear the gloves. I got my medication in my mini packs. I will hand it on. And the tubings here. I still use the aspectic techniques because here is a new one. Take it out. Sorry, I take it out. And remove the tabs and the spiking. And put the clamps close. Yes. I'll have here. Another side, we use the alcohol swabs to clean the primary tubing white pot. Here, the white pot here for 15 seconds, waiting for the dry. 1, 2, 3, 4, 5, 6, 7, 10, 11, 15, 15. Okay, now I'm gonna connect my secondary tubing with the primary tubing. Twist until it's secure. Now I'm gonna do my back prime. Back prime means I'm gonna open the clamps, let the primary solutions come out to my secondary tubing. I put the secondary tubing lower and make it. Open the clamps. Now the fluid here come to here. I'm waiting for the champ to the halfway. Champ to the halfway to make sure there is no air bubble inside. Why is halfway or 2/3? Because we can see the drips in the chamber. So we don't make it full. Give more. So it's slow, but I'm still waiting. No, I can see it's okay. There is no air bubbles inside. I just close it. Now I'm gonna put the secondary mini bags here, and I will lower the primary bags. Lower than the secondary. Now the secondary is high and the primary is low. Now I'm gonna set up the LRS pump. Let me see the screen, okay? Let me see the screen. We pick the secondary, the medication here. Page down. Methylprednisolone. $250 milligrams. Yes. Yeah, settled down already. Duration time is 1 hour. Okay, we start. Oh, before the start, we're gonna put this one, secondary clamp and start. Now you can see it here. The drips here. Yeah, the screenshot and the drips here. It's slow? Yes, slow to make sure. It's slow, yes. Can I put it back? Okay, Fiona, so I will do my write document and write evaluation after 15 minutes to come back to you. Now it's the core bears within your touch. I will back to you after 15 minutes, okay? The last thing is the critical thinking. Critical thinking, the question is if the INR number is 2.2. So what can I do? Because the IN number is the usually range is the 0.8 to 1.2. If the result is 2 is pretty high, if the residents did not take any anticoagulant therapies, so it means the patient is still facing the bleeding risks. So as a nurse student, I should think about the bleeding risk, about GI bleeding, gum bleeding, and melena and timoturia bleed and GI bleedings. So I will keep monitor, focus on vital signs, dosage, medication, especially for the bleeding. If any abdominal findings out, I have to report to the physician immediately. That's all. Thank you very much.